Okay, my presentation is on anxiety. I have a few family members who are diagnosed with anxiety and it affects their everyday life and they have a hard time dealing with it. What is anxiety? Anxiety is the feeling of being nervous, shaky, unease about an event or something or someplace that you are unsure of. Anxiety is when a person is very nervous, scared, or worried about the scene around them or an event coming up. Anxiety affects 18.1% of adults in the US. Some symptoms of anxiety: feeling shaky, restless, hyperventilate, worry, unwanted thoughts, hard time concentrating, insomnia, and nausea. I have a sister who has anxiety, and when she goes somewhere and there's a lot of people around her, she gets very nervous and just wants to get out of there. She has a hard time dealing with it, and she gets very red, shaky. She can't sit still. So those are some symptoms of the anxiety disorder. Some treatment for anxiety is medication. The medication prescribed are antidepressants, buspirone, and benzodiazepines. These are medications that help relax the body so the patient is not so worried and anxious. The other treatment for anxiety is therapy. Therapy is used for anxiety. It's called the cognitive therapy. This therapy helps the patient with how to solve a problem. Therapy gives them a problem and helps figure out ways to overcome the problem with a helpful solution. Cognitive therapy is very efficient in helping patients with anxiety. So this therapy is they sit down with the patient and they talk about situations that can happen and what are some ways they can come up with a solution to be more calm, to get over their anxiety, and this seems to be a very popular and more safe treatment for anxiety. Short-term consequences. Some are not being able to treat everyday tasks such as driving, going to the gym, having a job, hanging out with friends, everyday things that people do. Your nerves and stress are so high that it eliminates you from the tasks that you would usually be able to do. So having anxiety, you're not able to function the way someone without it would. You're always thinking about it, you're always having symptoms from it. So it's very hard to deal with anxiety. Long-term consequences. Some patients with anxiety can't take the thoughts running through their head every day and the stress level and the other effects from anxiety. This can lead them to become suicidal. The University of Maryland Medical Center states that 18% of people with anxiety disorders may attempt suicide, and nearly 39% of people with anxiety disorders have suicidal thoughts often. People can't take all the stress and the embarrassment of feeling so shaky and unease that they just can't handle life anymore. This is a very serious condition that needs to be taken. I think anxiety is one of the most not important, most popular disorders that is in the US. Here's some of my reference for the information I got on anxiety.